program of personalities, politicians, and perspectives. This morning we have personalities and perspectives. And because of the rulings of the FCC, I can't tell you what I think about the politicians. So we'll just bypass that part today. We always try to start Viewpoint with a kudo or two, and I'm going to work with the kudo in right with the introduction. Kudos to the Logan County Health Department under the management of Mr. Don Cavey, who is with us, and Kara Davis, I'm sorry, dear, Director of Nursing. We appreciate you taking your time. I know that you're pretty much chained to your desk out there because there's so much going on. So we appreciate the presence of Mr. Cavey and Ms. Davis, Logan County Health Department. The old fellow goes back to the point where we didn't have a Logan County Health Department. Don, Kara, Irma Potter, Mrs. Omer Potter, was the health department. She was a Logan County nurse. And what I remember so vividly about her is that she really was married to that job. She did a whale of a job. And one of my several community activities, the one in which I took a great deal of pride and pleasure in, was the Elks, what they called the crippled children. Now, can you imagine that, using a term like that today, crippled child? We've come a long way. But in any event, the Elks had a great charity there. And they raised a lot of money, and they did, in fact, take care of crippled children. We had a Dr. Hugh Cooper, came from Peoria every other month and saw the youngsters and treated them, and Mrs. Potter was right there on top of all that. And as chair of the Elks Crippled Children Commission, she would call me and ask me, I need money for this, or and I would say here every time, I'd say, Mrs. Potter, if you say we need it, just do it and send us the bill. Because if she thought we needed it, we needed it. And so she was our forerunner of the Logan County Health Department. So you're located over there on 109 3rd Street. Tell us a little about who wants to be the spokesman first, Kara or Mr. Cavey? The number of associates you have on board that ship there.
We have 20. We had 20. I think it's 21 actually. We just hired somebody in our HealthWorks program, so I want to say 21. Mm-hmm. Yeah.
Well, I'm going to say this about that. I've said it before on air, and I say it on the courthouse steps. If I could get to the courthouse, boy, we got something going on there, haven't we? There's a lot of weight on that weight up there, the roof, James. We're going to have those gentlemen back to talk about the advancing of the courthouse dome. But in any event, I've said it often, you have a great staff out there. When a client walks in, or a customer, whatever you want to call them, or a patient, as the case may be, walks through that front door, they're going to be taken care of in an immediate and a very pleasant manner. You have a great front staff. And then, of course, as you go back into the various offices for treatment and or consultation, each staff gets a little bit better. So I don't know whether you, Kara, do you crack the whip there to make those people do so well? But seriously, you do have a great staff.
I do have a great staff. I really don't have to crack the whip because they're that great. So
they're dedicated to their job.
They are very dedicated. They all three of my nurses in the public health department love their job. I mean, because they're definitely not in it for the money. So they're in it for definitely taking care of public health matters. So.
Tell us about your inoculation program. The only one I'm familiar with is the flu shots. And that's so easy and so seamless. You walk in there and they greet you in a pleasant manner. In a few minutes you're in the room and you get stabbed and you're out of there. That's a very successful program, apparently.
Yes, so immunizations is one of our big programs that we have at the health department. We vaccinate 2 months all the way up to 110, or if you're still alive after that, that too. But yes, we do all vaccinations, everything. We bill private insurance, we bill Medicare, we bill Medicaid. We're also doing the COVID vaccines right now that are free of charge. We have clinics for that periodically. a couple times a week, and those are all on our website.
Does the Logan County Health Department have any clue, and I don't know how you would keep track of this, for goodness sake, as to what percentage of our county have been in to be vaccinated at this point in time?
Yes, Don actually looked that up.
Okay.
It's not just us doing vaccinations in the county, it's the hospital. Abraham Lincoln Memorial Hospital has been doing a lot of vaccination clinics. CVS, Walmart, and Walgreens are also doing COVID vaccines, and then us as well. And Don has that percentage.
Yeah, right now, in terms of doses that have been given in the age 16 to 64 group in Logan County, 42% of the people have at least received a dose, whereas the age of 65 plus, we're looking at 81%, right? Roughly 81% of those people have received their first doses. In terms of fully vaccinated in Logan County, meaning they've either received their one dose of Johnson & Johnson or their 2 doses of Pfizer Moderna. Right now, 37.5% of the adults 16 to 64 are vaccinated, whereas seniors 65 and up, 77, just over 77% of those people are vaccinated.
In that category, I'd like to kind of throw a little kudo out to the folks at the Christian Village. They arranged for us to get our shots out there, and it was very well organized. We were supposed to report, each of us reported at a certain time, and we reported on time, a little bit ahead of time, and it wasn't any time at all. We were taken in there and got our shots, and we had to wait 15 minutes for whatever that was reason, because we didn't have any results of any kind, any reactions. But Christian Village did a great job in making sure that those folks out there on that campus had a chance to be inoculated, and apparently it's working, because we haven't had any, to my knowledge, we've not had any problems out there at all. And by the way, they keep you informed.
Correct. There are no outbreaks in the county anywhere right now, so we have no active outbreaks. And we have 2 active cases, and that is all, so that's great for our county.
Yeah.
Well, I'll inform Judy that she can go to her favorite bar then.
Matter of fact, our testing rate for the 7-day rolling is under 1% for positives, so we're at like 0.5 right now, which is real good when you look at our region, the 18 county region that we're in, as far as the Illinois recovery region. They're averaging like 1.1%, so we're doing pretty well in Logan
Has this
County.
COVID thing thrown an extra workload on your desk, throughout all of your desk in the health department?
Oh, yes. Oh, yes.
Significantly.
Yeah,
Significantly.
You're nodding
yes.
your head.
Yes, so Mary Anderson, who has been at the health department for over 30 years, she is primarily the COVID nurse. She does all of the investigation, she calls all of the positives. That is all she does. And then Carrie...
No, she smiles while she does that.
Sometimes it's a little frustrating for her,
I'm
for
sure.
sure.
Yeah.
And then Carrie Slager, one of my other nurses, her and I do all of the vaccinations. Sometimes Cindy Harrelson, my other nurse, sometimes she helps as well with vaccinations, but she is primarily over the contact tracer, who calls all of the contacts of the positives. And right now we let our contact tracer go because we don't have a lot of cases, so Cindy is actually doing the contact tracing now. In addition to Carrie and Cindy are taking care of the clinic. So everything else still goes on. You know, we still are doing vaccinations and STD testing and lead and TB, and so they are taking care of that on top of everything. And then I do all of the testing for COVID, and then Carrie has recently been taught how to do the testing, and she has been assisting with that when I am unable to.
Now, I noticed we've all seen it on the great TV screen. The testing, is that a nasal situation? Are you doing
right now,
nasal?
that's what we have. Yes, there
That's what
are
you
other
do.
options, but that is what we do. Yes, we do. We have 2 forms. We do the nasal pharyngeal, which goes, everyone says, to their brain, but it doesn't actually go that far.
Yeah.
And then the rapid, which goes just right inside the nasal
Yeah.
area, and that's the one I do primarily because that's a 15-minute result, and I have a lot of those tests, so I do those.
Well, they're out of luck. They're going for my brain. So.
We're not going for your brain. It just feels like it.
Don, as the director of the Logan County Health Department there on 3rd Street, when you walk into that door daily, it's always a new ball in the air. What is there one particular facet of your management that's more of a problem than any others? Miss Davis is shaking her head. Yes.
I try not to think about those things when I go to work.
Because every day it's a new deal.
Every day is a new deal, absolutely. Not really. I mean, I think overall, I think things have been, all things considering, we've got a great staff, like Kara said, and they make it easier for me. That's for sure. My challenges are, how are we going to move forward now that COVID has set us, 2 steps back? How do we move forward again? And right now, my focus is looking at not only immunizations. Right now, we're immunizing people 16 up. Right now, how are we going to get those kids that are we've immunized for the most part, but the people that are 12 to 15, we are immunizing them now because the Pfizer vaccine has been approved for that. But our numbers are low. We want to get those numbers up. We want to get the younger kids in to get their vaccine. And we started, Pfizer was approved, about a couple months ago for this?
I don't know. It's all running.
Yeah. And initially we had a lot more people in our clinics, but now that's kind of tapered off. So, how do we get more of these younger kids into the clinics? And so we've got to strategize on that. Right now, my focus is starting to turn more towards, now that COVID, and like Kara said, last year was a rat race for everybody, including myself. But now that we have to set our sights on other things, I have a strategic plan in place for the health department. We've got several health issues that we want to address in the county. Mental health is one of them. Substance abuse is another one. Chronic illness is another one.
I would want to talk about that, substance abuse.
Absolutely. Yeah. But those are some of the things that, we need to say, hey, you know what? We're tackling COVID, but we need to get our sights back on, our 5-year plan, what we want to do to address those things. Plus, we want to get our finances in order. Finances has always been a huge issue, not only for our health department, but health departments across the state. We tried to push the statewide local health departments tried to push legislation to increase the local health grant, which is right now $19 million that has to be distributed among 97 health departments. Yeah, and we were pushing to get that to 30. Legislation did not pass that, so we're still at about $19 million.
Well, they still pass themselves a raise, though.
I won't get into that, but I will say that if you look at the $19 million that's spread throughout the state for all these health departments, doing the math, we got a $42 billion budget in Illinois. That's like less than 1% of 1/10 of, less than 1/10 of 1% of the entire budget is really going to public health. It's so small. And so we're hoping, we were hoping that with COVID, public health really showed its value because legislation was leaning on us to get out, get these clinics going, get the word out, to do the contact tracing, and we did that. But we were hoping that would help springboard us to getting more funding. We do get grants, and I do say that's much appreciated, but if we can ever increase this local health protection grant as a whole, I think it's going to strengthen public health altogether, because when this pandemic hit, the thing that really struck me was how are we going to afford to do all this? How can we do all this stuff that the state's asking us to do? They're not giving us the funding. Unfortunately, the state reacts when there's a pandemic. Then they start throwing the money at us. But, we really need to sustain ourselves for the long term. Public health does. And if we could somehow, get that funding level to a higher level, then I think that would, strengthen public health overall. So, we're not scrambling next time a pandemic comes around.
Speaking of funding, if we don't give some time to our sponsors, we won't be funded so you and I can sit here and visit. So we'll let Mr. Rice go right ahead. Right back live in the studios here at WLCN, high on the County 2250 Road here in County Road. Our guests this morning at Viewpoint, Mr. Don Cavey and Kara Davis, Director of Nursing at the Logan County Public Health Department. They've taken some time out of their busy day, and they are busy with all these things that are going on. So 648-5510. Give these folks a courtesy of a call if you have any questions. Don't complain to them now. Be nice to them. Seriously, you may have some questions. Golden County Health Department kind of operates under a shelter out there on 3rd Street because what they do, they don't get a lot of ink, so to speak, a lot of publicity. They do a tremendous amount of good in Golden County. Seeing patients, I presume, on a daily basis for a variety of reasons. You mentioned response to our drug situation. Is that a daily problem for you, substance abuse? As you open your doors each day out there, do we have people on a daily basis with that problem?
Yeah, I think as a whole in statewide, but certainly in Logan County, we work with the hospital here. Every year we do every 3 years we do a needs assessment for the community, and that assessment involves community input, and that's really been one of the ongoing issues over the last several years is the problem with the increase in drug use in the community. So we're aware of that, and we're working. Chestnut Health Systems is working with Logan County, Mason County right now on a program to develop a coalition where we can all work together to develop a coordinated, holistic approach to working with folks who not only are drug abusers but are trying to recover from drug abuse and get back on their feet. And it's in the early stages right now, but we are working with Chestnut Health Systems.
The bottom line, Don, is it comes under the broad heading of addiction, of various, whatever it is, drug or booze or cigarettes. Or addiction is a terrible disease in and of itself. It doesn't have to be an addiction to anything, but an addiction. And I would presume that's a pretty sophisticated situation to work with addictive people, because each and every one of us who are addicted to something have different ways in which we demonstrate that addiction.
Yeah, and it really takes a medical or a social worker, some professional in that field, and unfortunately, there's not as much access to those services. We'd like to see more of that. And I don't think it's just Logan County issue. I think it's statewide. So we're, and I know part of the program and that we want to achieve with this is creating programs and creating opportunities where people can have access to those services. And certainly mental health too is another area that we are, hoping that we can create.
The mental health. That's a deep subject.
Yes,
and
it is.
Each of us react differently to each and every circumstance. And it's easy enough to say to somebody who's hooked on booze, for instance, shape up. Well, sometimes that's not so easy. And history is replete with people who shape up, and then the first thing you know, take one step forward and 3 steps back, and they're back in the same problem again. It's a great societal problem, and it creates a real problem for these men in blue who are on the streets. As an officer makes a routine stop, that person could be addicted to something and under the spell of whatever it is at the time. So it creates a real danger for our police.
Yeah, and that's where recognition and being trauma informed and people that can if we can get people in the community to understand what these people are going through and how we can address them. I think you're right. It's a very difficult situation having to work with these people, because a lot of them have been drug abusers for so long that how do you correct it? The damage has been done on a lot of these people, so how do we make it better for them? And that's something we want to look at too, is down the road maybe being more trauma informed so people can understand and identify people with drug issues and try to work with them and help them find the assistance that they need. it's a hard area to work with, and I know at the public health department, our nurses, and I know Kara would agree on this. They see a lot of people that come in the doors, and one thing we try to do is we try to refer people to the services if our nurses recognize somebody has an issue. We do try to assist and try to make referrals.
I presume, without knowing a doggone thing about it, but I presume that there are days when somebody walks through the door and somebody looks up and sees it and says, "My God, not them again." You know?
I think that's everywhere, though. I don't think that's just at the health department.
You can say that at Walmart if you want.
I think so, yes.
Well, seriously, I don't make light of that. There are people walking around with serious problems. And by the way, those of us who have gone and gotten our flu shots, immunization, or COVID shots, or whatever, now those are, how are those paid for? You mentioned it earlier. Go ahead, Kara.
So we bill Medicare, Medicaid, and all private insurance. So, for example, Blue Cross Blue Shield, Health Alliance, things like that. So we bill insurance companies to pay for those. And if you don't have a form of insurance, then you would need to pay cash for those vaccinations. Now, COVID's free. COVID, you don't have to pay anything for. That's completely a free vaccine right now.
Is the obtaining of COVID vaccination materials, is it easy to get the medicines for vaccines?
For COVID, yes.
Yes.
Yes, we don't have a problem right now. We did at first because I think everybody was wanting to get the shot, but right now we don't have a problem at all.
What's your least, your biggest problem when you walk in the door, Kara?
Well, I'm trying to
Make
get
sure we're fully staffed.
That, and I'm trying to get caught up on HealthWorks, which is the DCFS medical case management. That's one of our departments that we have at the health department, and that just means that kids in 13 counties that go into DCFS custody, they come through our office, the charts, not the actual children, and then we medically case manage them. So I actually was doing that too because we have so many kids that I'm trying to get caught up from last year. So that's my biggest problem at this point right now.
This is 2021. You're still working on 20.
I am, yes.
Goodness.
I know.
Yeah.
It's hard to type in 20 and then to go back and type in 21 in the computer. I get confused a lot.
Is it safe to say that somebody's going to fall through the cracks there because of your workload?
And it has, yeah, and they have, unfortunately. But I am getting caught up. I have 21 charts left, so I'm getting those caught up, and I'm hoping to be done by the end of the week with that, and then I'll start over.
Yeah, and I'll add to that on the other end too with the environmental health, and because that was my area before I became an administrator, and we sadly, and we may have talked about, we lost somebody in our department, our director last year, and with COVID. In addition to that, we haven't been out doing, our environmental health staff been called in to assist in the response effort for COVID. So we're trying to get back and establish ourselves with environmental health. I've had to jump in and help out with water wells and septic systems. So I'm actually back out in the field every now and then. But we do have the person that is our emergency preparedness coordinator, who's doing an outstanding job with getting our clinics organized, and
yeah, we should
she's
definitely.
Wonderful job. Faye Allison doing a terrific job. She is doing that, but she's also taking the helm with our environmental health, and so we just hired someone new, Leah Benner. She just started a month ago, about. Full-time with us, and she'll be going out and doing inspections, but Faye is working with her to train, and I'm also lending any assistance I can at this point. So really, as a whole in the health department, I think we're just trying to get back on track now that, hopefully we're starting to put COVID behind us now. Phase 5 is here now. Things are opening up a little bit. Certainly our work isn't done with COVID. We still have ways to go, but at least we could start to look forward again and get back on track with some things.
You do testing for restaurants and so forth, and we have wells in the county. We city slickers don't think much about that. We just turn on the tap and there's our water. Many of our rural friends don't have that luxury, or if they're in the rural part, they definitely have wells. How do you tell if a well is solid or not? Can they call the health department and you have a testing facility?
Yeah, that's a good question. I'm glad you brought it up. We do. We have test kits that the public can come in and purchase a kit. It's $8. I want to say it's not expensive. They pick up a bottle, a box, a mailing label. They could take their own water sample. Because the lab at the state closed over weekends, we ask people when you take your own sample, do it between Monday and Wednesday and overnight it to the lab at Springfield. So people come in, they buy their own kit, they can take their own water sample. We urge people that are on a private well, private wells like owning your own car. You've got to take care of it. Not like a car, you check your oil. Well, on a well, you better check your water. And so we encourage people that own wells to at least every year get a water sample. The state used to test for nitrate and nitrite as well. However, due to budget, they've backed off on that. But at least people can get their own bacteria test by coming to the health department and getting their own kit. I will also add this, and I'm glad you brought it up. And this is something that came up years ago. And we kind of stumbled on it. We discovered it, and it's on our website. We've got a full section on it. But there has been some right here in Atlanta and west of I-55, even where you're at here. A lot of the wells are contaminated with arsenic, and that's something that we've had on our. I have that on our website. We put news releases out, and I always try every now and then to inform the public that if you're on the Mahomet Aquifer, which is here on the northern side of the county, and especially west of I-55, get your well checked for arsenic. If people want to get on our website at www.lcdph.org and go under environmental health under the potable water program, like I said, there's a whole section with a map. There's information on labs that people can contact. The state lab's not going to do test for arsenic anymore, but there are labs in Springfield and Peoria that will test for arsenic. So we do encourage people that are on their own private well, especially in this area where we're sitting right now. Not a bad idea to get your water tested for arsenic.
You checked the water today, Jim?
I don't drink the water.
Am I all right? Well, seriously, arsenic, that's kind of an insidious thing. Just a little bit drop by drop by drop, and that takes its toll. Yeah,
it's been linked to various cancers and health issues, so we really encourage people, if they're drinking that water, to get it tested.
648-5510. Tara Davis and Don Cavey representing Logan County Health Department. Give those folks a call. They take care of your health, and you may have something that's been bothering you. They can't send you to the dentist. That's another department. But, speaking of dental, we had a dental department in Logan County. Is that still viable?
Yeah,
it still is.
We still have the dental clinic. It is managed and operated by the Southern Illinois University Center for Medicine here. They've got a federally qualified health center. They operate out of our building. So the dental clinic is still there. And anybody needs dental services, we encourage them. Call our number at the health department, but hit the extension for SIU, and they will be more than happy to assist.
648-5510. One more time. We're going to give to Judy and I. Well, by the way, Judith did not abandon ship today. She went to visit her brother, and I think she decided a couple extra days up there in Minnesota would do her well. Certainly better than what we're having here. Suppose I wanted to operate a new restaurant. What were the steps that I would have to, besides, of course, but the health steps, what would I have to take?
Well, first of all, call the health department. I think, we've run into situations where people will start a restaurant up and we'll find out about it, and then they'll tell us, well, we want to open in a week, and it's like, well, we need to go through it and make sure you've got, proper hand sinks in place and proper refrigeration, and you've got everything that the code requires you to have. And we want to avoid that. We tell people if you're thinking of operating a full-time food establishment or even a temporary food establishment, you need to call the health department first. And if people go to our website, again, I'll say www.lcdph.org. Go to environmental health and our food protection section there. Literally, our website walks people through if they want to start an establishment. all they have to do is read through it. It gives all the information. There's a plan review that they need to complete, and we need to do a complete walkthrough to make sure that everything's up to code. The last thing, if I'm a restaurant owner, is to open a restaurant and not tell the health department. Health department comes say, well, your hand sink is in the wrong place. You're going to have it torn out. You're going to have to move it here, and it could cost some thousands of dollars. So we do, I can't stress enough, call the health department first.
I assume that with the advent of the Logan County Fair, and by the way, we're all happy that's going to operate this year. It was under a cloud as whether or not they could or would, but happily, apparently, we're going to have the Logan County Fair. That brings a new workload to the Logan County Health Department because they have the food establishments out there. And do you make cursory checks or routine checks?
We do. Actually, if somebody's out there for the first time and we haven't inspected them, we're gonna issue a license. We'll go through, do the inspections. Some people, excuse me, who are out at the fair may be operating on a seasonal license, and so they're already licensed, so they're out there to do their temporary food. But we will still go in there to check to make sure that they have everything they need. So yes, everybody out there needs to be licensed through us, and we are out there to do all the food inspections. And the thing with the fair, I remember the first fair that I inspected, it was 100 degrees outside, and refrigerators are working awful hard during that time. So, it's a good thing that the public health department's out there because, we find food out of temperature, and last thing
doesn't take very long.
Yeah, absolutely, our job is to protect the public, and we're there to say, hey, you're gonna have to either get this food out of here or put it in a colder storage facility or something. So, we'll be there.
I guess it goes without saying, Don, that with certain vendors at the county fair that make the circuits, this county and the next county, you have people come in that you've had experience with down through the years, and you just know they're going to be okay because they're the solid kind of people.
Yeah, we have a pretty good idea. Once you get to work with people, and that's true.
How about the farmers markets? Does that come under your jurisdiction? Checking to make sure that things are okay there?
If there is a food establishment that is preparing food, or if they're selling anything potentially hazardous that needs refrigeration, then we'll be in there to do our inspections.
By the way, our hospital farmers market, I think that's a great addition to our community.
It is.
It really is. It gives some local people who have some skills a chance to demonstrate those skills and perhaps do a little business out there. And it's just a nice addition. This weather doesn't make it very nice for them. Darryl, what would be the problem, the biggest problem that hits your desk on a day-to-day basis?
Everything is really slowed down right now. So,
that mean you can work from home?
I do. I work from home once a week, actually.
Oh, do you? Seriously?
I do. Yes. On Fridays. I usually try to work from home on Fridays. So I do that. Really, I have a great staff. There isn't really much that comes across my desk lately, so it's been pretty good.
I know CARES has been real instrumental on, for instance, we want to get out and get the word out about public health and our services, because a lot of people don't realize, we have shingles vaccines, we have, we bill private insurance, as Kara alluded to earlier. We do all these services for the community, but the thing we hear all the time is, we didn't know public health did that. And so part of our strategic plan is developing a marketing committee, and I know Kara has been instrumental with that. That's going to be a project that it's going to be another undertaking. We're going to kind of get back into that. Kara's done a lot with our Facebook page, and so people want to know everything about the health department, you can certainly visit our Facebook page. So I think we all have our work cut out for us now that COVID is starting to go behind us, but we still have to look forward to other things.
Mr. Cabby mentioned the word shingles, Kara.
Yes.
Is that an important item on the horizon? Should people be aware of shingles?
For sure, and the vaccine there was a shortage of the shingles vaccine, and now there is not. And we had a waiting list of like 5 pages, but it has dwindled immensely. And we do carry that vaccine, and we do have it in stock now. So if you are interested in receiving that, you have to be 50 to get it, which is kind of disappointing. I wish they would lower that age. But yeah, so if anyone has had chickenpox, in the past, they are susceptible to have shingles, so you definitely should be vaccinated against it. That is not something you want to get. I personally have never had shingles, but I know people that have, and it is very painful. It is a 2-shot series, and we carry it.
You know, I never even gave that a thought, but a couple of years ago I was down at the VA clinic. By the way, I have excellent service with the VA. Some people complain about the Veterans Administration's medical services. I sure don't. I've had excellent care, particularly with the hearing matter. But the gentleman, physician's assistant, suggested, "Do you ever have a single shot, Bill?" No, never thought about it. And he strongly suggested, and I said, well, certainly, if you think so, let's just go ahead and do it. And then we did it, and that's the end. Never thought about it again. But you read about once in a while or hear about it on media. It can be a very painful disease.
Yes.
Or skin disease. That's what it is.
Virus. It's a virus.
It's a virus.
Yes.
Go ahead, Don.
I was going to, and I don't mean to get off subject here, and one thing just crossed my mind.
We've invited you here as a guest. We give you the mic.
One thing I will say, going back to the flu shot, I know, and Carol speak on this too, but these flu numbers were way down, and we think it's because people were taking extra precautions with COVID, which is interesting when you think about that. So it's... and maybe it's something down the road. Maybe, people in the community during flu season who are, compromised or concerned about flu, maybe, wearing a mask is, something that for those individuals come fall and the flu season that, they may want to consider. But I just wanted to point that out. Our numbers on flu are way down. And before we end, too, I just wanted to remind everybody, because the weather's getting hot out, and West Nile virus, again, I want to bring that up because that's a huge concern every year, but we will be out if the community, anybody in the community finds a bird that's dead that looks like it died of natural causes, wasn't run over by a car, and it's not decomposed. Those people could call the health department, and we'll if the bird does qualify, we'll take it, and we'll have it shipped to the lab for surveillance testing for West Nile virus. So that's one thing we are doing, and I know. And Karen and I had some conversation about this too, but at some point we anticipate that we're going to open for walk-in business at the health department. We don't know when, but we'll announce when that will happen. So stay tuned for that.
Well, Mrs. Davis, TB, I noticed here on my list that I stole off of the internet. You mentioned a TB skin test. Mm-hmm. Is that a prevalent thing today in today's times?
Yes, actually TB is fairly prevalent.
It is.
Logan County doesn't have any active cases right now, and we're not treating anybody for latent TB at this time. But we skin test anybody who goes to work in an extended care facility or a hospital has to be a TB skin tested. Any resident of one of those facilities has to be skin tested. Anyone who is going to school in the medical field has to be skin tested. So we do a lot of TB skin tests, and anyone that is diagnosed with TB in our county, we have to monitor them, we have to follow them, we have to watch them take their medications, because it is a public health nightmare if it does spread, because it is very susceptible to spreading. So, and I do have one nurse that deals with that. Her name is Cindy, and she knows everything about TB that there is to know. So
now your clients and or patients, however you want to determine, are you getting a number of us in my category, old people?
For just
day to day.
When we did blood pressures, we used to do blood pressures a lot, and we had a lot of people come in for those. And when COVID started, we did stop those blood pressures. But when we open back up to doing walk-ins, I think that we might start doing blood pressures again, just because I do feel like that is something that is very good for the community. Any age, actually, you can have high blood pressure at any age and have that checked. And we use the old manual cuffs. We don't do the electric cuffs, so I think it's more of an accurate pressure.
That's more accurate.
So the ones that you can buy to do at home, you don't do those. You do the electric, and I feel like those will show a different result than the manual. So I do want to start doing that again for public health.
Blood pressure, it's a very important thing, particularly for us in the advanced age stage. Is it so that blood pressure can destroy some of your bodily functions, such as your kidney dysfunction?
Oh, absolutely. Yes. Yes. You definitely need to maintain a good blood pressure.
And there we are.
Yeah, we need to make sure you have a good blood pressure. And we actually have a form now that we started a few years ago that if your reading is a certain reading and we're concerned about it, we make you sign it and we call your doctor, or we have you call your doctor right away.
Now, are the limits, do they change with age, say from 50 to 90? The blood pressure, the normal blood pressure for somebody in those categories?
It's not 50 to 90, it's usually 25 and up, because an adult, we call it as an adult. Usually you need to really stay within a certain range, and it's usually no more than 140, 150 over 80 to 90. That's what we kind of.
Now, I noticed you have satellite clinics. You have a clinic at Friendship Manor out there on Prim Road?
So that was, we did blood pressures, and that did stop once COVID happened as well. And we're not sure if we're going to start those back up again.
I see.
It's just right now we're still dealing with COVID vaccine clinics and things like that. But it may be on the horizon down the road. I really don't want to put my nurses in a facility because I don't want to have them end up with COVID or
yeah, absolutely.
Even though they have all been vaccinated, but still.
Yeah.
Well, go ahead, Don.
I was going to say, just speaking of clinics too, we've got several coming up, and if people want to get their vaccine, all they have to do is go on our website, on our homepage, and they can register to get into one of our clinics. Otherwise, if people who do not have access to internet can certainly call us. 217-735-2317 is our number, and we'll be happy to get them in for a clinic, for a schedule.
Now, if somebody has a problem with their refrigerator at home and they don't know it, that can be a serious illness problem if it's not caught right away. Am I correct in that?
Yes.
What advice would you have for our listeners just on a day-to-day basis as they go about their daily lives?
Well, as far as the refrigerators go, something I do is I keep a thermometer in my refrigerator. Because they should be, the air temperature in a refrigerator should be about 37 degrees, 37, 38 degrees. You want to make sure that the food itself is maintained at 41 degrees or less. I do carry also a metal stem thermometer. I use a digital one at home. I used to drive my family crazy because check the temperature, especially with chicken, something or ground beef. Those are the things you really got to check because ground beef can be contaminated throughout the meat. Steaks I'm not as worried about because you don't have less because the ground beef's comminuted. It's been chopped up and the bacteria can get spread around. Whereas steaks, far less of a hazard. But, always good to have a metal thermometer and easy to calibrate a metal stem thermometer. If it's digital, just fill a glass with crushed ice, put a little bit of water in there, stick the thermometer in there, and if it reads 32 degrees Fahrenheit within 1 or 2 degrees of there, then you got a pretty accurate thermometer. So it's a good way to check to make sure your meat thermometer is accurate.
So somebody like Jim who uses a beer test. Our time has come up again. I apologize for the fact we've run out of time. We didn't get the calls that I was hoping to get because you at the Logan County Health Department are performing a real service for us. You've been very generous of your time this morning to come up, Don Cavey and Kara Davis. You're doing a great job for us.
Well, thank you, and we're glad to be here.
You're on
Thanks
the firing line, and
thank you.
Subject to a lot of criticism if somebody wants to be nasty about it. But
no, that's never happened before.
Thank you very much for Viewpoint.